Hi everyone, in this video we are going to discuss about porcelain veneers and different designs, preparation designs you can consider for porcelain veneers. So let's look at different designs. So you have design which is feathered design, where you are feathering the edge during the incisal edge area. So you're not completely overlapping, you're not creating a window, just feathering the edge off, keeping some of the incisal edge intact. The other design is overlap design, where you're going over the incisal edge and creating that overlap. Or you can have a bevel design, or you can have a window design. In my clinical practice, I tend to do, I've done all of them, but I more lean towards doing a beveled design, where I reduce the incisal edge to get a nice aesthetic. So it gives technicians some space to create nice translucency. And by doing bevel, what I can do is I can select buccal path of insertion of the veneer, and I'll go through that in a minute. When you're doing preparation, you need to consider where is patient's contact point palatally. So if the contact point right at the incisal edge, then you cannot do bevel design. You may have to do overlap design and go over it and go beyond that contact point, because you do not want lower teeth contacting exactly at the point where veneer is bonded to the tooth. So you need to make sure that you have some space left between the contact points in order to give a good result and occlusal stability, and be sure that the occlusal force will not ping your veneers. Also, you need to make sure you have done occlusal assessment. You need to see the guidance, protrusive guidance is not riding straight on the veneers. Although if you're doing 3 to 3 veneers and if you're overlapping all of them, then you will have that protrusive guidance at some point overlapping onto the veneer. But you need to assess this and you need to control it. You want it to be as shallow as possible. You need to assess the proximal contact point, and that is very important, because when you are doing this treatment, you can use something called buccal path of insertion, and that is very conservative, because you are not drilling the tooth completely whole facial side. You're almost keeping your handpiece from the buccal path of insertion, because if you are avoiding breaking the contact point, then you will have a stable tooth when it comes to restoring or bonding the veneer. So there are 2 ways to prepare the tooth interproximally. One of them is you break the contact point and your junction is gone palatally. And if you do that, you can then do traditional preparation. However, if you want to keep the contact point, then you angle your handpiece and you can create a small undercut, but facially. And because of that, you can use the facial path of insertion rather than putting veneer from the incisal. You can put veneer from facially, and you can get away with reducing less amount of tooth tissue and also hiding that junction where porcelain meets the tooth. Because many times people decided the preparation, which is palatally driven, where the margins are on the palatal aspect, to prevent or hide the junction between veneers and the tooth. So this is another way you can get away from hiding that junction. This is again a case where we did before and after. For lateral incisors, we did veneers treatment. Bonding of the veneer, for me, as I discussed in previous video, that I always bond my veneers using heated composite, unless the veneers are in feldspathic porcelain and they are very, very thin. In that case, I would use Panavium. But otherwise, 99.9% of the time, I use heated composite and bond my veneers in that way. So I hope you found it useful. 3 tips for this video is that make sure you design your veneer prep before you have started prepping the tooth. Make sure you've done your occlusal assessment. Make sure you check your contact point. Make sure you know how you're going to do your prep. Either you're going to do buccal path of insertion or you're going to do incisal path of insertion, and make sure you tell that to your technician. make sure you have checked the occlusal contact points. That will help you in deciding overlapping, how to include that contact point, and using the prep and using your wax up, make sure you have done enough reduction. So create indices, or you can use the way sometime I would take the index of my wax up to a mock-up in patient's mouth and prep through the mock-up. And when you're prepping through the mock-up, you are then reducing over prepping or under prepping the tooth. So I will prep through the mock-up. You can have a special burst which tells you how much reduction you've done, or alternatively you can create putty indices and you can check in patient's mouth like we usually check for reduction of your crowns. So make sure that you have used all the tools possibly you can in order to do this veneer treatment. So I hope you found this short video useful. If you have any questions, please feel free to contact me on social media or go to my website www.drdevangpatel.com. Please share with your colleagues or friends. In the next video, we are going to discuss about porcelain fused to metal crowns and zirconia crowns.